So we are starting with antifungal drugs. Let's say this is a fungal cell. This is a cell wall of fungus inside which is the cell membrane of fungus, and we have nucleus of fungus. So we'll give drugs which will inhibit cell wall formation or cell membrane formation, or which will interfere with the processes going on inside the nucleus. So for remembering drugs, you have to remember this diagram. Here you can see there is a candy placed on the cell wall, and there is a tree on the cell membrane in which A is written. So the candy represents echinocandin, tree represents terbinafine, and the A here represents amphotericin, azoles, and amorolopin. So echinocandin inhibit cell wall synthesis, while these three drugs will inhibit cell membrane synthesis. Now, okay, so there were cell wall and cell membrane synthesis inhibitor. Inside the nucleus, a lot of processes going on. Like we have protein synthesis going on, we have DNA polymerase doing its replication or job, and we have mitotic spindles helping out in cell division. So we are inhibiting all these processes with the help of drugs. So let's see which are the drugs. See here you have to imagine that a polypeptide chain is placed on table. So tebovorol inhibits protein synthesis. Here is a flag which is placed on DNA. So flucytosine inhibits DNA polymerase, and the mitotic spindle you see looks like grapes. So griseofulvin inhibits mitotic spindle formation. So these were drugs acting on the structures of cell. Now we are classifying drugs on the basis of whether they are topical drugs or systemic drugs. The systemic drug can be of two types. They can be either local or systemic. Now imagine how, if you give a drug systematically in veins, how is it acting locally? So what's happening is when you give a drug systematically, the drug has high affinity for keratin, so the entire drug is going to concentrate at a place where there is keratin, so it will act locally. So we have systemic drug which can act locally also. So starting with topical antifungal drugs. These topical antifungal drugs are used for fungal infection of skin, hair and nail. The fungal infection of skin, hair and nail is called dermatophytosis. So we have drugs for preventing this infection. So you're learning this drug with the help of this diagram. Now we already know from our previous slide that this tree represents terbinafine and the table is tebovorol, and from A we have azoles and amphotericin. These azoles and amphotericins are very common drugs, okay? You don't need mnemonics for that. You just need to know that these are tropical drugs. And we have a circle on the table over here. So we have cyclopyroxolamine. It is represented by circle. So these are topical antifungal drugs. Now we'll study each of this drug in detail. First is teoborol. So what is this drug exactly doing? Inside the fungi cell we have tRNA, and the amino acid is linked to it, and we all know from this process the fungi cell is going to make its entire protein. So what teoboron does is it makes a boron bond with leucyl tRNA synthesis and inhibit protein synthesis. So it forms boron based bond with leucyl tRNA synthesis and it inhibits protein synthesis in fungi. Second drug is cyclopyrox. Now what does this drug do? It inhibits first cytochrome oxidase. Now this drug also has affinity for A plus ions. Now this enzyme is working with the help of these ions. Now if this drug is having affinity with this, so it's obviously going to stop the functioning of this enzyme. So it has high affinity for trivalent ions. So the enzyme which are using these ions won't work, and it also inhibits cytochrome oxidase. Before going with the third drug, we have to learn some basics. Is the fungi cell membrane is made up of ergosterol. Like in animal cell we have cholesterol. In the same way fungi cell membrane has ergosterol. So this third drug, amorolopin, is gonna inhibit the formation of ergosterol. What it does is it binds to the membrane and inhibits ergosterol formation. Now these drugs, the azoles, they are also doing the same thing, means they are also inhibiting ergosterol formation, but on a different side they are binding. So let's say we have ignosterol from which ergosterol is being formed. Now, to inhibit the formation of ergosterol, we need to stop this pathway, right? And if we stop this pathway, there will be increase in ignosterol. So these drugs increase ignosterol synthesis. So this is a summary of all these three drugs acting. Now topical azoles. Topical azoles, we have, let's say, 6 drugs. Now how are we going to learn these drugs? So you have to imagine a diagram wherein in your hand an elephant is sitting and it's drinking soda. So why only this diagram? Because we know topical azoles are applied on skin. So this is the skin on which we are applying the azole. So the drugs are luliconazole, the elephant name is luliconazole, cetraconazole for soda, and alfenaconazole for elephant. And these are new drugs which are anti-inflammatory action. We have another 3 drugs for which we have to imagine the same diagram. On your hand a mic is placed and you are hurt somewhere over here, so there is a clot. So clotrimazole, miconazole and iconazole. From mic we have miconazole, clot we have clotrimazole, and these are topical azoles which are applied on your skin. So this two diagram will make you remember 6 drugs. Okay, then we are done with topical azoles. Some important points about them: cetraconazole is given for itching and luliconazole is the longest acting, simply LL matching. Done. Okay, so now there is a fungal infection in your nail which is called tinea eugeum. Now to remove this fungal infection we are giving nail lacquers. These are simply nail paints in which a drug is there and drug is applied on your nails. This is the way of introducing the drug to your nails. So the drugs that are used in these are cyclopyroxylamine, alfenconazole, amorolfine, terbinafine and teboverol. All these drugs we have studied earlier, right? Now, now we are starting with systemic drugs for systemic infection. First drug here is amphotericin B. This is the most important antifungal drug in the entire slide, amphotericin B. So now let's see how it works. We all know fungi cell membrane has ergosterol. So what amphotericin does is it will bind to ergosterol and it will create pores, and from this pore the useful enzymes which are inside the fungi cell will be exposed outside. So if the useful enzymes are gone, then obviously fungi cell will die. So it binds to ergosterol, create pores and leads to the death of fungus, which makes them fungicidal drug. Now why these are most important drugs? Because they are fungicidal drugs. So they are used in many serious fungal infections and their drug of choice of cryptococcal meningitis, mucormycosis and Kala-Azar. This mucormycosis is also called black fungus. We'll study more about it in the next slide. So for mucormycosis, the drug of choice is amphotericin B. But amphotericin B is given initially in the active phase. For the maintenance phase, we have to shift to fluconazole. We'll study fluconazole in next slide. It's a systemic azole. So for active phase we are giving amphotericin B and maintenance phase we are giving fluconazole. Done. So an interesting fact about mucormycosis is during COVID we used a lot of steroids. So the immunity decreased and it led to mucormycosis in a lot of patients, right? Chalo. Now adverse effect of amphotericin B. Amphotericin B has 3 main adverse effects. One is infusion related reaction, where due to infusion you are getting fevers and all. Other is nephrotoxic and anemia. So most common side effect is obviously infusion related reactions, which are chills and fever. Most common dose dependent side effect is nephrotoxic, means if you increase the dose of amphotericin B there will be more side effects like renal tubular acidosis and hypokalemia. Now how we are going to be protected from these side effects? So we developed a mechanism like this is amphotericin B and let's say this is the renal tubule. Now, if this amphotericin B is exposed to this tubule, then it's going to cause damage over here, and all the side effects are caused. So what we did was we made liposomal amphotericin B. We made a cover outside amphotericin B, and this is liposomal amphotericin B. It is less nephrotoxic as compared to conventional amphotericin B. Done. So these were side effects of amphotericin B. First is infusion related reaction, then nephrotoxicity, and so the last part of this chapter is systemic azoles. These are the drugs. We'll memorize these drugs in the next slide, don't worry. So now we are focusing on how are this drug acting. So we all know fungi cell membrane is made up of ergosterol, which is formed from elanosterol with the help of enzyme 14 alpha demethylase. Now azoles inhibit this enzyme and prevent the formation of ergosterol. So I told you earlier this amorolophin and azoles, they work on the same mechanism, that they inhibit ergosterol formation, but they act on different site. So the azoles are fungi-static drugs. Amphotericin B were fungicidal drugs. So most of the fungal infections, the dangerous ones, the drug of choice was obviously amphotericin B, right? So now, what are the drugs in systemic azole? The first drug is ketoconazole. So let's see the drugs which are in the systemic azole. So first one is ketoconazole, and the second one is fluconazole. In ketoconazole, you have to imagine a old kettle, which is old useless kettle. We are not using this drug anymore. And fluconazole is the inflow thing. It is widely used among the azoles. So why is ketoconazole not used anymore? Because it is less potent and has microsomal enzyme inhibition. So you'll have to deal with its toxicity and all. It causes gynecomastia, adrenal suppression, and it's hepatotoxic. So we are not using this drug anymore. The fluconazole is the inflow thing. It's the drug which is used nowadays. It has maximum oral bioavailability and maximum CNS penetration. So this is drug of choice for candida and cryptococcal maintenance phase. We know that in acute phase we are using amphotericin B, and then we are shifting over to fluconazole for cryptococcus. Done. So the next, so let's say you have a non-serious fungal infection which is caused by sporothrix, blastomyces, and histoplasma. So what you will do is you will put all these three in a train, and the train is going to take this all far away. So from train we have itraconazole. So itraconazole is given as a drug of choice for these three non-serious infections, right? Now invasive aspergillosis, you learn this in medicine that it is the site is at lungs. So you have to imagine a warrior which is inside the lungs. So for drug of choice for invasive aspergillosis is voriconazole. From warrior we have vori. So the last one is mucormycosis. Now mucormycosis is a black fungus, so we need a black drug to stop this fungus, right? So we have a black soap. From soap we have posaconazole. So you'll have to remember these diagrams, okay? So don't go with mnemonics, right? Just go with these images. The advantage is here you will know that the invasive aspergillosis is acting on lungs, or it's something related to lung, that you will know. So it will help you in correlating it with other subjects also, right? Done. So now we are summarizing the entire drugs that we learned on this slide. So first of all, starting from here, on the cell wall we have echinocandin. On the cell membrane we have terbinafine, amphotericin B, azoles, and amorolophin. Inside the nucleus we have protein synthesis, which is inhibited by the taboboron. Then we have mitotic spindle, which looks like grape. So we have griseofulvin, and the flakes on DNA polymerase are flucytosine. Now topical drugs. So the topical drugs, I told you to remember this diagram. From tree we have terbinafine, azoles and amphotericin from A, teboboron. The circle represents cyclopyroxylamine. Now topical azoles, we have two diagrams on the skin topical, elephant and mic. So miconazole, iconazole and the clot over here, clotrimazole. The elephant named Lulis or luliconazole, alfinaconazole and cetraconazole. So for the systemic azoles, we have an old kettle and inflow fluconazole, and the three drugs which were itraconazole for the train itraconazole. Inside the lung we have warrior voriconazole and the black soap which is posaconazole.